Hi, my name is Aaron Gerds and I'm Editor-in-Chief of ASH Clinical News. Welcome to this month's From the Desk of. Well, it's March again, and as we plunge into March Madness, the headlines are filled with stories about online sports gambling, the number of people who are engaging in this activity, and the concern over that. But what might be concerning a lot more of us, or a hotter topic, if you will, in the world of medicine, is the accreditation process and the certification process, where entities like ABIM require practicing physicians to comply with what some argue are out-of-date methods of certifying whether or not you're adequate to provide care to patients. Likewise, hospitals undergo accreditation. Here we receive regular pages about the Ohio Department of Health inspecting, or more importantly, or sometimes more often, we get texts and alerts about JCO, the Joint Commission, coming to view our hospital to see if we are up to snuff in terms of our patient care delivery, and that we're not leaving any stone unturned when it comes to various safety metrics. And these things can be very stressful. We have entire departments dedicated just to getting ready for these types of inspections. So in the end of the day, we can get that certification, that stamp of approval, and that little badge icon we can put on our website. And what does all this do? Is this something that's beneficial? Is this actually improve patient care, improve outcomes, and make lives better for patients with blood cancers and blood diseases? And I think that's a big question. And as we begin to question certification processes for practicing docs and others as well, we should also pivot to look at accreditations for hospitals and see, are we really getting a bang for our buck with all of these efforts and all of this infrastructure that's been put in place to conduct these on-site visits? So we're going to take a little bit deeper look at that with our feature article on hospital accreditation. We also have a You Make the Call this month, which is kind of appropriate for March. What prophylactic treatment would you recommend for a basketball player who has had multiple episodes of hematoma? So very, very timely for the big tournament upcoming. In our pASHions section, we're featuring Dr. Alan Lichtin, former chair of the Committee on Government Affairs for ASH, and his passion for the violin. So a little behind the curtain of what Dr. Lichtin does in his free time. There's all that in our regular news coverage of the literature, as well as publications, blood and blood advances, and soon to be our new blood publications, and we'll have coverage for those as well. But we're very excited to present this feature article on hospital accreditation, and I hope you enjoy it. Well, that's all for this month's From the Desk of. Until next time, keep the blood pumping.